Hi, and welcome back to the channel, fitness enthusiasts, athletes, and everyone in between. This marks the beginning of an enlightening series where we're going to explore a variety of drugs and their impacts on muscle gains, strength, and overall fitness. From painkillers to performance enhancers, we're covering it all. Today, we're zooming in on NSAIDs, non-steroidal anti-inflammatory drugs, and their impact on muscle gains and fitness strength. NSAIDs like Ibuprofen and Naproxen, which are readily available over the counter at the pharmacies, are mainstays in managing exercise-induced pain and inflammation. Keep in mind, we're only focusing on NSAIDs that are available over the counter in this discussion. It's not to say that it doesn't apply to NSAIDs by prescription, such as Meloxicam. However, those are beyond the scope of this topic, as they are prescribed for specific diagnosis and require careful monitoring by your healthcare provider. But how do these drugs work, and what does that mean for your muscles? First, let's talk pharmacology. NSAIDs inhibit cyclooxygenase enzymes, COX-1 and COX-2. These enzymes are crucial in the production of prostaglandins, which are involved in pain and inflammation, but also in muscle repair and growth. Their pharmacokinetics involve rapid absorption, typically starting 30 minutes after ingestion, with peak plasma concentrations occurring within around 2 hours. Once distributed, they bind to plasma proteins, mainly albumin, allowing to efficiently travel through the bloodstream. This quick action is why you feel pain relief soon after taking them. They're metabolized in the liver and excreted through the kidneys, which is why it's crucial to be certain that you don't have any liver or kidney problems before taking these drugs. The best way to know for sure is to get blood work at your next doctor's appointment to check your kidney and liver function, among other values. Each drug has a unique half-life, which is the time it takes for half of the drug to be eliminated from your bloodstream. Motrin, which is ibuprofen, has a half-life of about 2 hours, which is why it's taken more frequently. On the other hand, Aleve, which is naproxen, has a half-life of about 12 to 17 hours, which means it takes longer to get rid of it. Many athletes find that taking NSAIDs is beneficial for many reasons, including relief of pain from intensity of the training, reduction in inflammation from sprains and strains, preventative measures, and just simply routine and habit. But here's the twist. The most recent meta-analysis of 2023 found that NSAIDs did not significantly improve resistance, performance, or muscle strength, and were ineffective in aiding exercise recovery. Let's dig deep into why that might be the case. Prostaglandins, especially those produced via COX-2 enzymes in our body, play a role in muscle protein synthesis and hypertrophy. Prostaglandins are a group of lipid compounds that perform several physiological functions in the muscle tissue, involving inflammatory response that follows exercise, especially resistance training. This process of inflammation, although perceived negatively, is crucial for muscle repair and growth. COX-2 enzyme is upregulated in response to muscle damage and thus causes production of prostaglandins, which lead to the necessary inflammatory response and help recruit immune cells to damaged site. Prostaglandins have also been shown to stimulate production of insulin-like growth factors, IGF-1, which is crucial in muscle growth and repair. Therefore, by inhibiting the COX enzyme, NSAIDs essentially reduce prostaglandins production and therefore impair all those muscle inflammatory responses and subsequently reduce IGF-1, leading to decreased muscle protein synthesis and hypertrophy. Therefore, by reducing strength gains and growth, overall muscle repair, NSAIDs inadvertently suppress key elements of muscle adaptation and healing process. This is particularly evident in large doses post-high-intensity training, where NSAIDs reduce muscle protein synthesis. Essentially, taking too many NSAIDs might hinder the very gains you're working so hard for. The key is moderation. A lower dose like 400 milligram of ibuprofen post-workout, appears not to impair muscle hypertrophy or strength. Timing matters. Avoid pre-exercise use, especially resistance training, where NSAIDs might mask the pain that serves as a protective mechanism, potentially leading to overexertion and injury. This can also preemptively inhibit the inflammatory response essential for muscle adaptation and growth, as mentioned before. If NSAIDs are absolutely necessary, the best time to take them might be several hours after exercising. This allows the initial natural inflammatory response, which is crucial for muscle repair and adaptation, to occur. A reasonable window might be 3 to 4 hours post-exercise, although individual response can vary based on factors like age, training status, genetic predisposition, and overall health. Variability can lead to differing results in terms of muscle growth and recovery, and this is especially important when considering the risk of gastrointestinal, renal, and cardiovascular side effects due to NSAID systemic action. Instead of NSAIDs, explore natural recovery methods, proper nutrition, hydration, adequate sleep, and perhaps physical therapies. Additionally, applying ice-cold packs to reduce inflammation or heating pads to reduce tightness in the muscle may be an effective approach. Furthermore, certain supplements like turmeric, omega-3 fatty acids, and magnesium, as well as topicals like menthol or arnica, may be better anti-inflammatory alternatives in recovery without the pharmacological risks. In summary, while NSAIDs can help manage pain, their impact on muscle gains is a delicate balance. Use them judicially and focus on natural recovery strategies. I hope this sheds some light on NSAIDs and muscle gains. Stay tuned for more deep dives into intersections of pharmacology and fitness. Don't forget to like, share, and subscribe for more insights. Train smart, stay healthy.